Welcome everyone to another one, or welcome back to another one of our free monthly wellness webinars. So excited whenever we do these things to see people who are registering for it. We always say it's possible that you may or may not be able to show up in person, which is totally fine during our live events because we do record these. So you'll be able to see the link after the event is over and watch it at your own pace if you're unable to attend live. So, June is the month where we are acknowledging and recognizing both Alzheimer's disease awareness and brain health awareness. That's the month that we do this. And we already went into Alzheimer's disease specifically about a year or two. So we've thought today we would give more of like a general overview around just brain health in general, some of the information that we think might be a little bit more related to general information instead of focusing so specifically on that condition. But at the end of this presentation, I'll give you some other resources that you can check out if those are things that you find interesting that you want to learn more about. Okay, let me just get my little cursor out of the way. The takeaways when we're done with this webinar, the takeaways that we hope you gain a clearer understanding, as you can see in front of you, some of the key nutrients. Obviously, we're dietitians, we're in the health and wellness world, but we focus a lot on food and nutrition. So we're definitely going to have a conversation around that. And also other factors that can either positively or negatively affect or impact your brain function. And last but not least, we'll do some practical strategies and some resources that are available for you, whether you are facing your own brain health concerns or you are working or caring for somebody who might be dealing with their own challenges. Have some housekeeping things, as you probably heard as you were entering into our session today. This is recorded. It's always recorded because, as I mentioned, for a lot of people, they sign up to register. They can't attend live, which is totally fine. They'll always watch it after the fact. I usually get these links out probably within a couple of days. So maybe by early next week, I'll send out the link as a thank you. And I'll talk a little bit more about that in a second. But then in a couple of months, we actually post this to Dish with Dina Television, Dish with Dina TV, which is our YouTube channel, and that becomes more publicly available for everybody who wants to see it or to access it. You can totally use the chat box at any time during this conversation. I'll check in on it and see if anybody has anything relevant related to what we're talking about. But there's always an official Q&A section at the end where you can ask us questions about brain health or anything else you want to talk about, hoping that we have time to cover whatever is on like the parking lot at that point. As I always say in these webinars, that I am a dietitian, not your dietitian. So please make sure that you are following your own personal and individual medical advice and whatever you are working with your own healthcare providers, and not to start or stop any particular regimen unless you meet with them first and get clearance for that. And lastly, as I said, the follow-up email will come in. Obviously, we collect your emails since you're registering for this. We have your contact information on hand. We do put out a monthly newsletter, so you can always opt out from that if you feel like we're inundating your inbox. But I would say don't do it just yet because we will follow up next week with the link to this recording and the link to the next webinar as well, and maybe even a couple of extra things. I'll talk about that at the end of this session. So if we've never met before, hello, my name is Dina D'Alessandro. I am a registered dietitian. I work and live out of New York City. I'm also an adjunct lecturer of undergraduate and graduate nutrition studies up at Lehman College in the Bronx, which is one of our citywide CUNY schools. I am also very fortunate that I'm the campus dietitian, the campus nutritionist there too at the Student Health Center. I've been working on campus there. Oh gosh. Well, I went back to school there about 13 years ago, and that's where I did my undergrad and my second degree undergrad, my graduate and my internship. And then I started working about 7 years ago there now. And that's where I've kind of been very loyal on that campus. So I'm very pleased with all the opportunities that they had given me. I also am the founder, owner, operator of what is known as like the Dish with Dina trademark brand, which is just a bunch of wellness, lifestyle, health, and nutrition things that I like to share across a variety of different platforms in the internet and the social media universe. So you can find me pretty much everywhere at Dish with Dina. Even if I'm not active on things, you'll find me at Dish with Dina. I have a lot of things under my belt, a lot of different experiences and trainings that I've gotten in the last 9 years of being a registered dietitian, which I'm really, really happy to share in the sense of being able to work with a variety of different patient populations and chronic conditions and life cycle ages and so on. and being featured in things like journal articles and magazines as well. But one of the favorite things I love to do is work with my nutrition students and help precept or supervise dietetic interns as they're navigating their own journey into becoming registered dietitian themselves. So I'm going to turn it over to my co-facilitator to introduce herself to you.
All right, thanks, Dina. Thanks for having me. My name is Nakama, and I am a dietetic intern with Teeth and Associates Distance Dietetic Internship. I'm also a master's student at Lamar University, where I am studying applied nutrition. My past experiences include mental health clinic administration, where I've worked at a clinic for the past 5 years, recently on a project called the QIC, which is a Quality Improvement Collaborative, and it is a New York State program that works with mental health clinics to implement programs that focus on improving client outcomes. I'm also passionate about helping people manage their GI-related symptoms through nutrition intervention. Thanks for having me.
Thank you. Thanks for being here again. Mahama was with us at the kidney health webinar a couple of months ago, and she's returning for this one as well. So we always like to share a little bit if we're doing, organ systems or systems throughout the body, a little bit of like anatomy, roles and functions of what we're looking at. Obviously, this is the brain, and you've probably seen this before. And what you're looking at here is the cerebrum, which is that front part of the brain, and it includes things known as the cerebral cortex or the lobe. So you can see those in different colors. They are responsible for so many different processes in our bodies, things like emotion, thinking, problem solving, verbalizing things, the ability to process visual information as well, major parts of hearing and perceptions. And so if anything is damaged or impaired in any of these differently colored sections here in your brain, you may see signs of, outside influences of that. So you might have slurred speech, or you might start forgetting some things, or you might not be able to process anything that you're noticing visually. And you also see down there on the bottom the thing called the brain stem, because this is part of your central nervous system, and that indicates the functions around things like your motor skills, your breathing, your heart rate, and other sensory functions too. So brain ailments can encompass a wide variety of conditions and disorders and diseases that can affect both the brain itself and also the nervous system too, that impact the various functions that we just mentioned. So I'm actually going to let Nahama take over and share with you what some of those are.
Okay, so let's talk about some neurodegenerative disorders. So these are diseases that include the progressive deterioration of brain cells and nerve function, and they lead to cognitive decline and motor impairments. Examples may include Alzheimer's, Parkinson's, Huntington's disease, ALS, also known as Lou Gehrig disease, multiple sclerosis, ataxia, and some of you may be aware of the actor Bruce Willis, who was most recently diagnosed with this condition. With their progression, these disorders can affect every aspect of a person's life, such as their mobility and their balance, swallowing, bladder and bowel function, blood pressure fluctuation, sleep, mood, and speech. Treatments may include meeting one or many of the healthcare providers, such as neurologists, physical therapists, speech pathologists, cardiologists, psychologists, dietitians, and social workers.
Thank you. So now we're going to move on to cerebrovascular diseases. And anytime you see the word vascular in something, it just means where the blood is, the blood system. And so these conditions will affect the blood flow to the brain. Usually probably the more common one that you have heard of is the stroke, where you have the issue with the blood going to the brain, or something like an aneurysm, anything that might be a clot that finds its way up there that can cause that. So in cases like this, if people are more at risk for that, we'll talk a little bit about risk factors in a sec. Some of the treatments around this can include things like blood pressure modifications or medications. Again, right, keeping that blood pressure down of swelling and going up to the brain or putting you at risk for those strokes. And or blood thinners. These are also technically known as anticoagulants to keep the blood running a little bit smoother and reducing the issues around clots. Cholesterol lowering drugs, so those are known as statins, if you've heard of something like avorvastatin, and also blood sugar medications or blood sugar modifications, because we are coming to see that not necessarily just in the case of people with type 1 or type 2 diabetes, but also neurologically speaking, we are noticing some correlation with insulin resistance. And some of the notes that I have here for myself, and also what we've talked about in the future, we have yet to actually see this officially be integrated into the terminology, but sometimes we hear the language around Alzheimer's disease being treated as quote unquote type 3 diabetes, because there could be an increased risk of dementia or Alzheimer's disease if people are not necessarily managing or monitoring their blood sugar.
Okay, so let's talk about mental health disorders and related to brain health. So conditions like depression and psychosis can also be categorized as a brain ailment, as they are diagnosed with the Manual of Mental Disorders. Anxiety and depression and bipolar can also have an effect on food, focus, and sleep habits, and vice versa. Eating disorders or disordered eating patterns can be triggered or influenced by social settings, negative self-talk, or past traumas. Common neurodevelopmental disorders include intellectual disability, autism spectrum disorder, and attention deficit or hyperactivity disorder. Understanding these disorders involves recognizing early signs, providing appropriate support, and promoting neurodiversity awareness. All of these conditions can be characterized by impairments in cognition, emotions, or behaviors, and often require multidisciplinary interventions for management.
Let's talk about risk factors, right? Things that may or may not be within your control. Well, we first have a lot of times around any chronic conditions, this discussion around genetic predisposition. So if you know your family history, that would be a great way to understand a little bit more about what you might be at risk for. But that said, as I bring up a lot of times in these webinars and through the classes that I teach, we have come to understand that genetic factors really are only about 19 to 20% worth of what the health outcomes can be. Sometimes the rest of it is lifestyle factors like your food, nutrition, and things that we're going to talk about in the upcoming slides. But a lot of times those things are also related to other factors like what you see in front of you here. Environmental factors that are outside your control, like air pollution, noise levels, toxic chemical exposure from things like pesticides and pollutants. And we always acknowledge the socioeconomic factors or the social determinants of health as well, where you might not have access to quality healthcare, nutritious foods, education, all of those other things that really do play a role. So multifactorial, as we tend to say, understanding also that most of the research, which makes sense, most of the research done on brain health and brain activity is done in laboratory animals. And of course, humans have a wide ranging and ever changing list as we go through lifestyle cycle changes or anything else that might be in our world that we have to meet up with or interact with. And so that can make mitigating these issues a little bit more challenging. The research that we have, like I said, is mostly based on lab stuff, but each individual person is really important. And that's why we also encourage healthcare providers to approach things with a patient-centered approach. And for patients that are working with us which we'll talk about later on in our discussion about keeping track of some things that you're noticing and maybe checking in on some lived experiences and having some patterns or indications that you know might put you at risk for things like this. If you have been following along or attending any of our previous webinars, you know that we pretty much address the gut microbiome, both the good and the bad bacteria or the not so good bacteria that lives within us in nearly every topic we present, because that really does, including this one too, because that really does, the interactions play a huge role with the health and in our nervous system. We have what is known with the gut-brain connection, something known as the vagus nerve, the central nervous system that I just mentioned before with the brainstem, and this bi-directional communication that your gut, if it's not feeling great or you're undergoing some GI stress or disorders, can make you feel a little bit foggy or interact with, not such negative effects with your brain, and vice versa. If you're dealing with mental health disorders or brain issues, that can affect your ability to digest and really support your immune system. So let me show you a little bit here, or tell you a little bit here about how this kind of goes through this whole process more anatomically. So we have the gut health, right? So the good bacteria and maybe the not so good bacteria in our gut, that through the production of neurotransmitters. So those are like your hormones, like serotonin. And the regulation too of what we call inflammation or chronic inflammation. So you might remember from a handful of months ago, we did a whole conversation around what that means, what inflammation means. If you are dealing with something like chronic stress, so there's good stress, like I'm getting married or I'm going for a job interview or something positive, like I'm building a house and I'm excited about that. But then if you're also dealing with some chronic stress that's not so great, like you're under a lot of stress for financial issues or relationship issues or other things that are maybe, health related things too, that can also alter our gut microbiome, just like any other mental health issue like anxiety can too. And it could also possibly lead to that chronic inflammation, which is associated with cognitive decline. Some of these things, as Nahama said before, it's really important that we take that into consideration when we're talking about the comprehensive approach to healthcare and making sure that we always address mental health in our discussions as well. So you're going to the doctors or you're going to the dietitians or you're going to your specialists, it's possible they might ask you things like, are you suffering from stress, or do you have a support system in order to be able to see those positive influences if we start engaging in being able to support you in that way. Because just like I say a lot of times with like the pillars of health, if one falls down, they all fall down. But in the case of the opposite is true. If you support one, then we really do see some ripple effects that other aspects of your life or your health might also be positively influenced.
So it comes as no surprise that what we eat actually impacts our brain health. A diet that is rich in berries, leafy greens, whole grains, nuts, and fatty fish has been associated with a reduced risk of cognitive decline. Omega-3 fatty acids, antioxidants, and B vitamins also support brain health and reduce inflammation and oxidative stress, two processes that are strongly linked to neurodegeneration.
And next up, I'm going to share with you because sometimes we actually do have like approved diets that we can implement if we're looking to work with somebody who is showing signs of cognitive decline or maybe in the early stages of some of these disorders. So, one of these diets that we implement is known as the MIND diet. It's actually a combination or a hybrid approach, which includes parts of the Mediterranean diet, which I'm sure a lot of people have heard of before, and this thing known as the DASH intervention, which is dietary approaches to stop hypertension. Hypertension is blood pressure issues, high blood pressure. We mentioned before in that cerebrovascular discussion that that's one of the ways that we can help reduce the risk of cognitive issues by controlling our blood pressure. So I'm going to share with you on screen here these kind of like top 9 ingredients or food groups that have been approved or are included in this diet. So the more that you can get out of this, the better. And a lot of times when we're meal planning or trying to figure out what to eat, kind of prioritizing some of the things that you see in front of you. And I'll also give some side notes to some things that you may or may not be able to do. So green leafy vegetables are at the top of the list here. We usually say aim for about 6 or more servings a week. So, every time you can have a salad or have a side dish of cooked spinach or whatever kind of dark colored vegetables might be available to you in your either raw version or cooked version. Now, the side note here, the green leafies are usually quite high in vitamin K. So if you are taking one of those anticoagulants or those blood thinners, those are purposely designed to not coagulate or not let your blood clot, but your green leafies have vitamin K, which is supposed to help you clot, make sure you're not going to, bleed excessively. So sometimes there's an interaction there. And the rule around this is really just to be consistent with it. It's not to completely get rid of it, which some people are told by their doctors, and that is not true. Or you might have heard things on commercials like you have to take a blood thinner, but now I can't eat lettuce anymore. And that is not true. It's more about being consistent with your portions. So not eating too much on one day and then not eating anything at all the next day, just, being kind of portion appropriate. And then, quite literally, yes, all other vegetables are invited to the table. We usually tend to prioritize the non-starchy things, so things that are a little bit more, or I should say less in calories and a little bit lighter, like carrots or string beans. And then the more starchy foods like potatoes, we limit a little bit of that, but we still would encourage flexibility in our diet because there is nutritional benefits to all of that too. Interestingly enough, yes, all fruit is invited to the table too, but berries are spotlighted here because they are quite high in antioxidants. So those are the things that help with our cell protection. And so we're talking about things like strawberries, blueberries, raspberries, or even cherries could be a part of this too because they're really deep and dark in color. And that could be something, again, maybe if you're not a fruit fan, you can add a handful of those things into your smoothies, or you can have a side dish, or use it as like a dessert at the end of the day. Nuts are next on the list here, provided that you don't have an allergy to anything. Try to get about 5 or more servings of nuts each week. And we talk about servings. I usually say about like what fits in the flattened palm of your hand is a serving or a portion size of that. And we don't really specify what kind of nuts are available to you. So you can eat peanuts, walnuts, whatever you feel like adding to it. Nut butters would also be included in here too. I would say maybe about 1 to 2 tablespoons if you're going to do that in a serving size. Using olive oil as your choice of your cooking method. So instead of something like butter, which we'll talk about in a sec, as your main cooking oil, or as an extra virgin olive oil as a form of a dressing like a salad. And then we have whole grains. So here I just want to indicate and specify too, not everything you eat has to be a whole grain. We try to be really sensitive and respectful of people's cultures, and a lot of people do use rice or grain-based foods like pasta in their traditional meals, and so you don't have to substitute every single grain with a whole grain. But when you are seeing the amount of food that you might be eating, we do encourage you to include things like oatmeal, quinoa, brown rice, and whole wheat pasta, and maybe even whole wheat bread as well, 100% whole wheat bread. Fish. So if you're a fish person, this is great, right? Eating at least once a week. So this is too, you can kind of mix and match some of these as well. Some of the more fatty fish in a good way, omega-3 fatty acid types of fish would be things like salmon, sardines, trout, and tuna. We don't ask you to eat too much of this because then there is the discussion of some potential mercury toxicity depending on the kind of fish that you are eating. But about, well, I say maybe about 1 to 3 times a week would be okay. Beans. So now here is a plant-based food that is very high in fiber. Some people do consider it to be kind of like a starchy vegetable, and that would be things like your beans, your lentils, your any kind of legume family like chickpeas, and also soybeans would be included in that too, at least 4 times a week with that. I love adding things like chickpeas and beans or black beans to my diet, so that's very easy for me. And yes, you can do the canned version of these as well, but I would always encourage you to just make sure nothing extra is added to the ingredients list, or if it's very high in sodium, to choose a low sodium option, or crack open the can and rinse out the extra brine that's in there to get rid of some of that excess salt. And then last on the list here is a lean protein known as poultry. So that is your chicken or your turkey, obviously not in the fried version. If you're going to add that to your diet, we would recommend grilled or broiled instead. And then some of the items here on the kind of like, limit slash avoid list. I don't ever like to vilify anything. I don't want anybody to be afraid of certain foods, but ideally we're putting these on the occasional list of how we integrate those into our daily or weekly meal plans. So butter and margarine limit to about a tablespoon a day. Yeah, I know. Cheese, RIP cheese, not necessarily. The Mind Diet actually recommends eating cheese less than once per week. That is offensive to me as an Italian because I'm contractually obligated to eat both pasta and cheese in my diet, a little bit more than that. But just being mindful of the types of dairy products that you're getting, I think is really the point here. Red meat, we said before, ideally replace what you can for the most part in your diet with some of the poultry or the fish, and maybe aim for no more than 1 to 3 servings of red meat. And this also includes things like pork and lamb, by the way, as well. And then fried foods. So fried foods, and what you see here is pastries and sweets, numbers 4 and 5. These are what are categorized usually as your more ultra processed foods. So the Mind diet in particular limits, or I should say highly discourages any kinds of fried foods and says limiting pastries and sweets. But of course, you got to have fun when you're eating. We don't want everything off limits, but I would probably say limit it to maybe once a week for fried foods and pastry foods in particular too. Just be conscientious of the portion sizes you're getting of that. Before we go to the next slide, I just wanted to mention a little bit of criticism around the Mediterranean diet because it feels like kind of one size fits all. It gets slapped onto a lot of general guidance that we have in the nutrition field, and people trying to look at it as the gold standard in a lot of cases. But let's just acknowledge that the Mediterranean diet does focus predominantly on the European cuisine. It's not necessarily representative of other diverse dietary practices from across the globe. Although I guess we could argue in the slide you saw before, the plant-based foods and lean products are going to be applicable no matter where you live in the world. And maybe the conversation is focused a little bit more around portion control or portion sizes and methods of cooking in order to quote unquote kind of like healthify your diet. And of course, some of these things might not be readily accessible or affordable depending on what kind of budget or socioeconomic factors are currently you're involved with. So like I said, with the beans or other things, you could purchase packaged foods or canned goods, frozen items, equally nutritionally dense, just making sure you're being mindful of the nutrition facts label, that you're avoiding or limiting as much as possible some extra added things that might be in those food items.
So let's talk about some simple meal ideas that we can add to our weekly plan. So over here we have a chickpea bowl that contains not only heart healthy, but also brain healthy ingredients like olive oil, herbs, roasted chickpeas, quinoa, and mixed greens. These foods are rich in plant-based protein, fiber, and phytochemicals, which is a naturally occurring compound found in plant foods that act as as an antioxidant, and that can help protect cells from damage and may help reduce the risk of various diseases. The vitamins and minerals within this meal can actually support our physical and mental health. Something like this is easy to make and can satisfy anyone who is following a vegan, gluten-free, dairy-free, and/or nut-free diet. And then we've got our oven-baked salmon that you can serve with a side of turmeric, cauliflower, and wild rice. The ingredients here contain omega-3s, anti-inflammatory spices, and fiber, and they go well with anyone following a pescatarian, gluten-free, and/or dairy-free diet. If you have a fish allergy and you're not a fan of salmon, you can easily substitute something like roasted chicken or tofu in this dish. And then we've got a coconut lentil curry with spinach and sweet potato, and that contains some nutritious plant proteins, iron, B vitamins, and anti-inflammatory ingredients. And it is great for anyone who's following a vegan, gluten-free, and/or nut-free diet. You can also add some animal protein like fish or chicken to this as well. And then we've got our blueberry walnut overnight oats, and you can have that for breakfast or any other meal throughout the day. And it includes some oats, chia seeds, blueberries, and walnuts, and that benefits your brain health as well with their antioxidants, omega-3s, and fiber. You can also add some water, plant-based milk, or dairy milk as an option if you'd like as well. And if you have a nut allergy, you can substitute sunflower seeds instead of any nuts that is included.
Yeah, we're always going to talk about physical activity and keeping moving, but of course, we want to caveat this or disclaim it that make sure you're getting medical clearance before engaging in any sort of physical activity, especially if you are prone to injury or you're recovering from something like that. And we'll talk a little bit too in a second about some mobility limitations as well, where you can implement physical activity into your daily and weekly plan. So regular physical activity has been shown, and it feels like it's coming out in research as the most effective way to support our brain function and reduce our risk of neurodegenerative disorders and diseases. We can, by moving, we move around the oxygen in our body, we get that blood flowing to the brain, and it actually enhances something called neuroplasticity, which I'm going to talk about in a second. And this also, in turns, promotes that really important brain function of those proteins that create things like the serotonin in your brain, and also the survival or the repair of neurons and brain cells. So, study shows that physical activity individuals who are physically active actually have a lower risk of Alzheimer's disease and other forms of dementia. On the right-hand side, we're going to share with you what the dietary guidelines for Americans are. Every 5 years, the government comes out with a new protocol based on research, and this has been consistent for quite a few decades now, of encouraging people to get in at least 150 minutes of moderate intensity aerobic activity. That could quite literally be anything like walking pretty quickly around the block to gardening. And then if you're doing more high intensity or vigorous intensity activity, we usually say aim for about 75 minutes a week of that. And then the second bullet there that you see is weight bearing activities as well, about 2 or more times per week. It could be strength bearing exercises. It could be body weight stuff, doing planks, lifting weights, anything like even a water bottle, using things that are kind of available to you, resistance bands. Those things will really help with improving our blood function and our brain function. But physically speaking, we've talked a lot in past webinars about it also helping with maintaining our overall muscle mass. And as we age, naturally, our body does deplete in that sense. So getting ourselves built up in that way, figuratively and literally, can also help with that too. I just want to clarify here too, as I made a note for myself about the 150 minutes a week. It seems a little bit daunting sometimes because that comes out to about 30 minutes a day for 5 days in a row or otherwise. But we've come to see that every little bit counts. So in my example, I break it down into about 3 times a day. So yeah, I'll have days where I can do 30 minutes in a row at the gym, and other days I set an alarm, and like today, I'm doing a million different things. I've only got a few minutes in between things. So while I have these breaks or before or after I'm having my next meal, I might do like a quick sprint or quick bunch of jumping jacks or something just to kind of get the heart rate going. So 10 minutes incrementally over the course of the day leading up to 30 minutes hits the number that we want to have there. The real issue is more along the lines of being sedentary. So if you are always inactive, it's not the best. And that can also impact our mental health and our physical health as well. So here's where I just wanted to clear or at least give a little clarification in that if you do have mobility issues or physical limitations, or you are recovering from something, obviously make sure that you're working with your doctor, your healthcare provider, your physical therapist, your occupational therapist to do what you need to do to get blood flowing and circulation going and to strengthen areas that you're able to strengthen and allow yourself rest.
So sleep and stress are often overlooked, but they play a significant role in our brain health. Poor sleep disrupts the clearance of toxins from the brain and puts us at risk for things like Alzheimer's disease, chronic stress. We all talk about chronic stress, yet we do very little about it. Exacerbates inflammation and impairs cognitive function. Improving your sleep hygiene and your environment and your habits before bed and throughout the day can positively affect your sleep quality and quantity. You can consider strategies such as mindfulness meditation, CBT, cognitive behavioral therapy, and setting regular bedtime routines to help you create a plan for better sleep and stress management.
Yeah, I want to take a minute here just to interrupt if anybody would like to chime in the chat. And Nahama, you and I will talk about this too. Do you have a current bedtime routine? Whether you are struggling with sleep or you are great with it, like what is your strategy for it? So, Nahama, what do you usually do? Because you've got a lot on your plate as an intern and with all the things that you're juggling in your own personal and academic life. How do you manage your own sleep hygiene?
Yeah, so I'll tr usually try to have an alarm that rings when it's getting close to bedtime. A lot of the time, I'll be snoozing it past the time that I should be, but I will usually have an alarm, and then I have a slight routine where I will wash my face, brush my teeth, get in pajamas, get ready for bed. Maybe be have the little light near my bed on rather than like the big light, just to kind of get us into the mode. I feel like having a set routine can kind of help you with getting into like kind of the psychological space of getting
Hmm.
ready for bed. Yeah, what's your routine?
Yeah, in the zone. I am almost exactly like you, except I was going to ask you, how late do you go to bed? Because my alarm goes off at 8 p.m., where I'm like, I got to
Yeah,
start winding
a
down.
couple hours after that.
I'm on the like the farmer's hours. I usually wake up around 5:30, 6 o'clock in the morning. So about 8 o'clock at night, my alarm goes off, and I will say somewhere in the vicinity of about 2 hours after that, I'm making my way to actual bed. So I will do the things that like put the pajamas on and get myself into the mindset of I'm heading to bed. But I might watch like a half an hour of television, or I might read through some stuff, or maybe I'll allow myself a little bit of scrolling on the internet just to catch up on some things. But quite literally at a certain point, like all screens have to go off because I just don't want that stimulation anymore. Maybe I'll do tea or I'll journal. I'm like you too, with I kind of dim the lights and I kind of change the mood for everything. We're very fortunate that we have some blackout curtains. So, and I have what I call like my sexy setup where I have my headset and my eye mask. I don't want any interruptions while I'm sleeping. So I really try to prioritize that because back in the day, I was not doing well with sleep. Sleep is a huge factor in a lot of our health outcomes. So we encourage everybody to, prioritize that if you can. Okay, so let me talk a little bit about this thing called neuroplasticity, which I mentioned before. It's basically just a fancy way of saying that our brain has the capability of repairing itself or recovering from some potential damage, obviously, within reason. But some of the things, the notes that I made for myself here too, were allowing ourselves to adapt and change and promote the ability to learn new things, okay, new tasks, new whatever, languages, the ability to enhance existing cognitive capabilities. So maybe you're going from level A to level B to level C at a certain time and building up and improving in that sense. Sometimes it can even with recovery from some traumatic issues, like if you're recovering from a stroke or recovering from traumatic brain injuries, obviously it might take a lot longer and it depends on the situation, but you might see speech come back, you might see motor skills come back, you might see memory come back. So that's really kind of cool to know that our brain can do that. Also, strengthening areas where function has been lost or declining. I'm laughing at this because I constantly say, is it menopause brain or is it early onset dementia? Like I never know for sure if I'm dealing with cognitive impairment, but I know that I'm going to share with you in a second here too. We're going to share with you in a second here too of the things that we can do to help strengthen our brain cognition and our functions. So, hopefully all is not lost and it's nothing to be too concerned about. And a lot of these things can obviously improve overall brain fitness as you'll come to see.
So we've got some brain stimulating activities. Keeping the brain active through a wide range of engaging and challenging exercises can help maintain cognitive function and improve our mental well-being. Some of these activities can range from playing games at home to learning new skills, and all of which can benefit our memory, focus, and overall brain health. An example of that might be meditating and visualizing, which includes walking through the steps of an action in our brain. You can also do some playing card games or board games with some family, some friends. You can do a crossword or a number or a jigsaw puzzle. You can play some checks and checkers. You can do some video games that include strategy and critical thinking. You can learn new skills or learn new music. You can learn some vocabulary or have some language lessons or tactile and engaging hobbies like knitting or gardening. You can try some exercise that includes some dance or sports or Tai Chi. You can even try just socializing and asking questions and remembering people's names and interesting facts about them. So here in front of you actually looks kind of interesting because our first response might be like, whoa, what's going on here? We have what we call the Stroop test, which is to test our reaction time of reading these words. So you can see that there is a mismatch between the color of the word that is here and also the actual word of the color, if that makes sense. So for example, you might see the blue that is actually not in the color blue, it is in the color red. So as you look at the words, you can say it out loud or you can just say it in your brain and you could see how fast it takes you to see what color it is versus what word the color is in.
Yeah, I think I told you to Nahama when we were going through this that when I first saw this, I was like, wait, what? But that's important to note. The fact that we can recognize that, oh, that something's wrong there. What's going on there? Like I have to say the word of the color, I have to say the color itself. So little things like that, like reaction time. And that brings me to some of this here too. So if you obviously, let me start with just saying neurodegenerative disorders are quite complex, but the steps that we take, and we always try to encourage people to either prevent something from happening or manage quickly something from progressing. So this means going and getting screenings done or early detection of stuff. And, obviously with anything, small, consistent changes hopefully can lead to significant benefits over the long term. So if you're worried about your own brain health, like I said, the mild cognitive impairment that I'm starting to notice in myself a little bit too, or you're noticing a loved one showing some signs of this, or maybe just to enforce and move forward with kind of like strengthening whatever is currently there, take a look at what we have some suggestions for you. So you could either speak with your healthcare providers or keep track or look up information about medical evaluations. These are these diagnoses that typically involve a medical and a physical exam. Cognitive tests that assess memory. So I bring up my mom a ton in these webinars. I was joking before that I accidentally said she was 90 when she's only 89 and she got very mad at me. So she's 89 years old and she has an evaluator that comes to her house about every 6 to 12 months. And they actually do a little function like this with her. So they'll say, we're going to talk for about a half an hour. I'm going to give you 3 words or phrases that I want you to repeat back to me when we're done. And it could be something like Mr. Smith, Main Street, the number 13. Okay, I've said those words to you now. And in 30 minutes, when we're done doing our other evaluation, I want you to repeat those words back to me. And sometimes she does remember them and sometimes she does not. And again, it's nothing to be too afraid of, just something to just keep in mind, pun intended. So those can also deal with like thinking skills and other mental functions. Additional assessments, those can be literally things like blood tests or imaging, brain imaging, like an MRI or a CT scan, because a lot of those neurological or neuropsychological testings could be used to rule out something. So if you do feel like you may be at risk for something, if there's a genetic predisposition, it might make you feel a little bit better to get something ruled out, or just to feel comfortable if there is something that's ruled in that you can confirm, then at least you know what to do from that point forward. Symptoms and history. I am a huge fan of people bringing notepads to their doctor's appointments, myself included. Keep track of stuff, collect data. Don't obsess too much about weighing and measuring your food or anything like that, but do keep in mind things that feel like they might be patterns. So like eating something triggers a gut issue, or if you're noticing cognitive decline, writing something down and just letting that collect as far as information that you can bring with you to your doctor's offices and be able to share some information that supports what you're there for. Comprehensive approaches, we talked about that before too. Engaging an interdisciplinary team, whether it's a pediatrician or a dietitian or a cardiologist or an endocrinologist, a lot of us are here to help support you. And because we're so multifactorial as humans, so goes along the lines of treatments as well. Then monitoring and following up. So you have the information, you do the screening, you get the information of what you need to know. What's next? Keep in mind of what you have to do with next. So that could be treatments, making sure you're not stopping or starting anything without notifying your doctor and keeping up with whatever treatment plans are you have to keep up with. Also, it's not written on here, but lifestyle habits play a huge role. Obviously, we want to address that too. Stopping smoking. One of the hardest things I've ever done in my life was stopping smoking. So my heart goes out to anybody who's trying to do that, but it is worth it. Preventing and managing high blood pressure, like we mentioned before, very directly correlated with brain health for sure. Managing your cholesterol levels, and because cholesterol is so closely tied into things like strokes or artery issues, so we want that cerebrovascular discussion. We want to make sure we put that we want to focus on that. Getting enough sleep, as we just said too, staying socially active, engaging, not living in isolation, whether it's virtual things or doing a happy hour with somebody or hanging out with people for brunch, making sure you get some of that on your calendar as often as possible. Managing blood sugar levels. So if you are dealing with type 1, type 2, or pre-diabetes, making sure you have that in check, either taking your metformin, taking your insulin, modifying your diet or your healthful lifestyle factors, because we just said blood sugar, we're starting to see a correlation with increased risk of Alzheimer's disease or other forms of dementia. That could be an issue with insulin resistance. And everybody hates when I do this, but it says on my notes here, reducing alcohol consumption. I'm going to very much encourage you just to avoid alcohol consumption. There is so much research on how not only is it class 1 carcinogenic, but it's very, very detrimental to our health. If you don't drink, don't start. If you do drink, please stop, or at least try to limit it. All right, lastly here, or maybe lastly, second to lastly, I want to share with you some information around caregiving. So we're not going to go too far into detail, especially with the time we have left with this. So I'll give some more resources coming soon. If you are a caregiver, like I'm a caregiver for my mom, but I'm not there as a full-time, home health aide for her. I manage a couple of her things and I go with her to her doctor's appointments. And when I'm there, in a long-term sense of maybe I'll spend a week or two with her and I'll work from her home. I try to make sure I implement some of these things too. So nutrition and cognitive decline, specifically some of the factors there that you might want to be aware of is there might be changes in food, taste, texture, aversions, preferences, smells, making sure also in that second one, managing meal times with dignity and structure. So we're not just putting slop on someone's plate and being like, eat this up. We want things to be visually interesting and feel like there is that engagement or that cultural approach to things as well of honoring and being sensitive to that too. But the structure around that also, people who are having cognitive issues might be better adhering to timing of things. And then, of course, if you are the care provider, you can also implement that as well. When they're eating, maybe you eat, or maybe you take a break. Support and respite. So I'll share with you a couple of resources in the next slide, as well as to where you are dealing with being caregiving. You're looking to get caregivers assistance as you are aging and as you're going into your later stages of life, or if you are dealing with a particular condition that is maybe making you feel a little bit more stressed out or a little hard to do. And as Hama did before, the brain stimulating activities benefit everybody. Everybody can benefit from those fun things. So on the slide here, we have some resources for you. Things like the Institute for Neurodegenerative Disorders, that is a wide variety of different things. Stroke.org, that's more like heart health. Of course, the brain is related to that too. Mental Health Coalition, like we mentioned before, anxiety, depression, any of those issues can also lead to and or vice versa. If you have a disordered eating pattern or eating disorders, vice versa there too can affect your physical and mental health. Caregiver Action Network and the Brain Injury Association. It's not just brain injury stuff in there. There's a wide variety of other resources, both kind of like patient facing and also provider facing too. So if you do work in the health and wellness world like we do, then there's some resources that you can take into account too, or there might be support groups on here that you can share with whoever you're working with. I mentioned earlier that, thank goodness we have about 9 years worth of content and information that exists out there for free for everybody to get if they want to. So 3 of the specific ones that are kind of related to brain health discussions today. I had a previous intern who focused on Alzheimer's disease specifically, so she the current research and the treatments for how to manage and or reduce the risk of Alzheimer's disease. So that is one of our wellness webinars that was recorded and exists on our YouTube channel. So you can go find that right now. I might actually put the links to all of these or the whole playlist when I send out the follow-up email. On the top right, it's healthy aging at any age. So, the earlier we can start with kind of recognizing what we may or may not be in control of and implementing some supportive habits, the better positioned we are for our future years. It's not like everybody who's in their senior stage of life is going to be more at risk for stuff, but we do see that be the case, but it doesn't mean that people in the younger stages of life are not at risk for stuff. And then the bottom right was a dear friend of mine who at the time was helping caregive for her dad who was dealing with ALS or Lou Gehrig's disease. So I had her on as a wellness webinar, and we also invited a caregiver slash patient advocate, and there's tons of resources on that too. So again, depending on where you think you might want to dive a little deeper, we have some other resources available to you through the YouTube channel. Now, all that stuff is free. If you want to work with me in a different capacity, whether you're paying or you're working in a collaborative way, there's some other stuff that we can talk about too. I do one-on-one nutrition counseling. I take a variety of health insurance. I work across state lines too, because a lot of what I do is virtual and we're allowed to work in different states as well. So sometimes I do group stuff or workshops or work groups, so many different things that I do. Yes, of course, there's always going to be access to things that you don't have to pay for, but if you're able to, or if you have insurance that covers, I'd love to see where we can go to get you a little bit more personalized or individualized assistance. In the business world, I work with so many nutrition students, interns, and newly credentialed dietitians. So I always love giving some guidance around whatever it is that you need to do to help develop your career. So dishwithdina.com is the name of my website. I'll also in the follow-up email, I'll share some other links and where you can reach out to me, or you can always just respond or reply to one of my emails and, ask me questions if you need to. Let's see, what else do I have on here? Oh, next steps, right? At the end of all of our webinars, we always say, like, what are the takeaways from this discussion? What are some things that you think, right? We mentioned before, small incremental goals that can lead to long-term benefits. So what is something that you want to start doing? Maybe you want to start including some green leafy vegetables in your diet. What's something that you feel validated in, like you're already doing it and you want to keep being consistent at it? And then what's something that you want to maybe stop doing or limit or reduce, especially if it's not something that is serving you anymore, or maybe it's putting you more at risk for things like chronic disease and mental health issues or cognitive decline. Maybe, maybe reducing fried foods or takeout stuff. So hopefully you've taken away a lot of stuff from this discussion. It was, again, a little bit more of an overview, generalized list of information for you. We always love when anybody signs up for these things, whether you're able to come here in person, quote unquote, in person during the live event. If not, like I said, you'll receive the recording link to this after the fact. You can watch it at your own time. That is available forever. And in a couple of months, it'll be available on the YouTube channel for the whole world to see. So I didn't see any questions or comments or feedback in the chat. We do have a few more minutes before we have to wrap up. So if there's anything else you want to chime in with or on, our next webinar is going to be, I'm continuing some of those organ discussions. So we're going to talk about liver health on Thursday, July 10th at 12 p.m. Eastern time. Again, you can find and follow me/us on Dish with Dina across the internet, across social media platforms, or you can check out everything else listed on dishwithdina.com, my website. Thank you to my co-facilitator for today, Nahama. Thanks so much for being here. And thanks everybody for being here. If you're watching this live or as a recording, we very much appreciate you.